Welcome back here with Sharp Rees-Stealy temporarily closing 3 clinics. It's a good time to talk about how to know if you really need to see your doctor. Many health issues can be handled at home with over-the-counter supplies. So joining us on the phone is Dr. Jyotu Sandhu from Sharp Rees-Stealy Medical Group. Doctor, thanks so much for being here. We appreciate your time.
Thanks for having me.
So we all need to do our part right now and not inundate hospitals. So when do our viewers not experiencing serious coronavirus symptoms know if they really need to go to the doctor?
Well, so most things, people need to understand can be handled remotely. And so when you need to go to the doctor, usually it's, a simple rule of thumb when you need to have a physical exam. And so, for example, things like skin infections that need procedures handled, simple suture removals where you have to obviously have the sutures removed, or preoperative evaluations, serial injections, for the classic thing that comes to mind are every 3 months. People come in for depot shots for contraception, things that need to be handled in the clinic where you can't handle telephonically, or different orthopedic exams where you have to evaluate that better, more emergent, like fractures and things like that.
So what can we do if our clinics are closed?
Well, so what we've done here at Sharp is we've made it very seamless from the patient's perspective. So what we encourage all patients to do initially is call our clinics, and they'll be routed just like before. So there should be no change in the perception from the patient's perspective. And we do have our larger clinics open, and our excellent nurses are trained to triage patients accordingly based on their certain conditions.
What are some of the ailments that people can be kind of dealing with at home, they can handle at home?
Yeah, so most things, given enough time, our body has a remarkable ability to heal itself. And so, for example, simple coughs and colds with home remedies can be triaged appropriately. Of course, with the COVID outbreak, we're triaging those appropriately. The best things that telemedicine over the years have tremendous help with is mental health issues, so anxiety and depression, where again, you don't need to have a physical exam, but you need to talk to people. And people find telemedicine to be great during these situations because they're at the comfort of their own home or workplace. And also, finally, reviewing lab work. So when patients just got things done at the lab and they want to know what to do next or how to take care of themselves based on lab work that they have done, this is a great way to use telemedicine.
Perfect. Dr. Jyotu Sandhu, thanks so much for your time. We appreciate everything the medical community is doing for us during this time. Appreciate it, doctor.
Thanks for having us.